Hi everyone. In today's clip, I will talk a little bit about hypothyroidism. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So, hypothyroidism is a condition where the thyroid gland does not produce enough thyroid hormones T4 or T3. These hormones regulate metabolism, as well as energy, temperature, brain function, digestion, and many other bodily processes. When they are too low, the body slows down. This is a thyroid hormone deficiency that can range from mild to severe and can affect multiple organs and systems. Common symptoms include things like fatigue, low energy, weight gain, hair loss, cold intolerance, dry skin and dry hair, constipation, depression or slowed thinking, slowed heart rate, and more. So hypothyroidism has several different causes. It can be an autoimmune disease or Hashimoto thyroiditis. This is the most common cause in countries with adequate iodine intake, where the immune system mistakenly attacks and damages the thyroid, reducing the hormone production. Then we have, of course, iodine deficiency. This is worldwide the leading cause of hypothyroidism because iodine is required to make thyroid hormones, and when we do not get enough, we face this issue. One simple test to do at home is for you to put a drop of iodine on your wrist and sort of rub it in. If the iodine stain is still visible after 12 hours, this is considered a sign of normal or sufficient iodine levels. This is a very basic test, and the results may or may not be accurate though because of skin temperature, humidity, evaporation level, and so on, but it's a starting point, so to speak. So another reason for hypothyroidism may happen because the thyroid is physically damaged or removed, including surgical thyroidectomy or radioactive iodine treatment for hyperthyroidism or even cancer. So if you are on some medications, they can also interfere with thyroid hormone production, including arrhythmia or bipolar disorder medications. Several nutrient deficiencies can impair thyroid function as well, such as vitamin A deficiency, which leads to reduced iodine uptake, and it impairs T3 uptake, reduces T4 to T3 conversion. And in short, the thyroid needs iodine and vitamin A to work together to work properly. When vitamin A is too low, the thyroid becomes sluggish, enlarged, and can't use iodine efficiently. So the brain responds by raising TSH, which is the signal from the brain telling your thyroid how hard to work, trying to force the thyroid to work harder. And this cycle sort of can lead to hypothyroidism and even goiter. So taking vitamin A, especially along with iodine, helps the thyroid work better and reduces swelling. Then we have iron deficiency, which affects up to 60% of hypothyroid patients. It impairs thyroid peroxidase, which is an enzyme needed for hormone production. There's also selenium deficiency, which impairs T4 to T3 conversion and immune regulation. We have zinc and magnesium deficiencies affecting hormone production and metabolic activation, which can also be the root cause. Pituitary and hypothalamic disorders can be a contributor because when the brain fails to signal the thyroid properly due to tumors, trauma, postpartum pituitary failure, the thyroid underproduces sort of hormones even if the gland is normal. So there's also metabolic or tissue level dysfunction, as some individuals have normal blood thyroid levels but impaired tissue level for T3 signaling. meaning cells do not receive or process the hormone effectively. This may happen in metabolic disorders like fatty liver disease, for example. So we also have something called subclinical hypothyroidism, which is a mild thyroid slowdown. This milder form of low thyroid function is more common than full-blown hypothyroidism. Many people don't even know they have it because routine blood tests may not pick it up. But even though it's mild, people still will feel the symptoms. Now, we also have severe clinical hypothyroidism, which is more serious thyroid slowdown. And this is when thyroid function becomes very low. It can lead to a variety of various health issues, such as extreme swelling and slowed body functions, hardening of the arteries, high cholesterol, and more. So the issue can also be due to hormone imbalance, like estrogen, for example. High estrogen levels can affect thyroid hormone availability, or insulin. Problems like insulin resistance may interact with thyroid function and more. So as you see, this is one issue that depends on many things and needs to be properly diagnosed. If you do want to do natural therapies, you still need to know what you don't have enough of. So it would be suggested to do a thorough analysis, including nutrient and micronutrient panel, comprehensive metabolic panel, hemoglobin A1C or average blood glucose levels, iron studies, fatty acid profile, food sensitivity panels, and thyroid panel to actually properly understand what is the underlying cause to be addressed and healed. Hope this has been helpful. Like and follow for more. Be the light.